Welcome, viewers, followers, and future patients of Havana Plastic Surgery. We are here with our board-certified plastic surgeon, Ivy League educated, Dr. Mameniskis.
Hey everyone.
Thank you so much for being here.
It's great to be here.
All right, so today's focus is on thigh liposuction, and we're here to delve into all aspects of this procedure. Feel free to ask any questions you may have. Dr. Mameniskis is dedicated to providing all of you with informative answers. So are you ready?
I'm all set.
You're always ready. All right. Question number 1. Can you provide a brief overview of what a thigh lift procedure involves and the specific concerns it addresses?
Thigh lift procedure is a procedure that deals with loosening or the laxity of the thigh skin, usually from aging or large weight changes. And so it addresses the looseness of the skin, improves the contour, makes the thigh skin tighter, and improves things like that, yeah.
Who are the ideal candidates for a thigh lift, and what signs or conditions make someone well-suited for this procedure?
Ideal candidates are patients who are close to what their ideal weight is. They're going to get the best results, certainly with that. Whose overall skin quality is not too bad. So if the skin quality, if the elasticity is very, very poor in the tissue, sometimes after the thigh lift, the skin can loosen again. So I think those are two of the most important considerations.
Is there a certain BMI?
Yeah, I would say less than 35.
Less than 35? Okay, good to know. Are there different techniques for thigh lifts, and how do you determine which technique is most suitable for a patient?
Yes, there are. There are two broad categories. One, the first category is called the medial thigh lift, which is the procedure that I prefer to do the most or most frequently because the incision is really hidden. It's way, way up in the groin crease from the front sort of to the back under the buttock crease. So it's really not seen. But that's mostly for patients who have loosening of that upper part of the thigh skin that kind of hangs down a little bit, but the lower thigh skin is okay. So the procedure removes the loose upper thigh skin, hides the incision well, and that can be combined with liposuction, maybe J-plasma for the lower thigh.
Oh, you could also add J-plasma on the area.
Oh, the rest of the thigh is sort of away from the area because it treats the upper third of the thigh.
Okay, interesting.
So the other category is more like a reconstructive procedure. It's geared toward patients who have had large weight losses, large changes in their body, and to the point where the entire thigh skin is just loosened and sagged and excessive. And that procedure involves making the medial thigh lift incision, but then going all the way down the leg to remove excess skin. That's really designed for patients just with a large amount of skin laxity, sort of like a reconstructive procedure. Right. It does leave a scar, but they feel a lot better, and it's helps functionally too to get around.
Awesome. What can patients expect during the recovery period after a thigh lift, and are there specific post-op instructions they should follow?
The two most important things after the thigh lift are, one, to really rest and avoid any real stretching of the scar area or the incisional area, because this is a procedure that kind of fights gravity. It doesn't pull things down, it pulls things up. So anytime we fight against gravity, we really have to be careful about putting too much pressure on the incision. The other is just keeping it clean. It's in a position, the groin crease, where a lot of body secretions
right.
and urine and such, and that's very caustic and cause the incision to open. So those are two most important things.
Awesome, good to know. In your experience, do patients often choose to combine a thigh lift with other cosmetic procedures? And if so, what common combinations are there?
That's one procedure I usually do by itself, because the recovery is very, very specific. And because, like I said, either procedure is working against gravity. So the patients really have to be just laying low. When they move very carefully. And if you do something in the upper body and the arms, it's going to affect their ability to position themselves well and can adversely affect the incision.
Good to know. What concerns or conditions can this procedure effectively address?
I think mostly just the patient's weight loss, aging, also in certain, maybe down this area of the country, sun damage to the skin, damage and some laxity from that. So that's another area that can happen sometimes.
Can it remove stretch marks?
It can. If the stretch marks are high up in the inner thigh, yes, that's another
good to know
area to think about.
All right. Are there instances where patients choose? Oh, sorry, we just asked that question. And how long do the results of thigh liposuction typically last, and what factors contribute to the longevity of the outcomes?
Well, the thigh liposuction's a great procedure. It's used in patients who have good skin tone, and then their skin has good elasticity, so the skin will tighten afterward. And I do it frequently. What was the rest of the question?
It's okay.
Typically, I mean, liposuction should be typically permanent. Once again, it can be affected by weight fluctuation and just aging in time with skin changes, but the fat cells don't themselves grow back.
All right, good to know. Well, I see that you have a lot of promotions right now here at Havana
Oh,
Plastic
good.
Surgery. So if anyone is interested in a thigh lipo or any other procedure, Dr. Mameniskis will be happy to do any procedure on all of you. So thank you so much for being here with us.
Yeah, excellent, excellent.
All right, well, thank you everyone and bye.